Would you believe me if I told you that all of this could be potentially resolved with just this? Let's talk about it. The 2021 Participation Report Card graded Canadians with a C+ for light physical activity, which means we simply aren't moving enough. Also, since the onset of the COVID-19 pandemic, both lower back pain and the incidence of mental health, anxiety, and depression are on the rise. Partially due to COVID-19 restrictions, but again, we're simply not moving enough. Something simple and easy to implement, like walking and moving more often, and choosing to primarily breathe through our nose rather than our mouth, can solve both of these issues. So let's get into it. Stress is going to change how we breathe. Whether you are trying to meet deadlines, are experiencing family trauma, or are being robbed, your brain is going to perceive the stress all the same and induce the fight or flight response. During the fight or flight response, your body is going to induce a series of physiological changes, most notably an increase in your respiration rate or your breathing rate. And when your breathing rate changes and increases, we tend to breathe more through our mouth rather than our nose. More on this in a minute. The problem with this is when we are under chronic stress, we are chronically breathing through our mouth. That means we are almost always in a state of fight or flight. And when we're always in a fight or flight response, the levels of compensation one can feel in their posture, how they breathe, and even sleeping are inevitable. Breathing through your nose is so important, and here's why. The diaphragm muscle is key and imperative to a high-functioning human body. Breathing in through our nose engages this diaphragm muscle more efficiently, and when that diaphragm muscle contracts, air is literally sucked and pulled into the bottom of your lungs. Now, if you try to breathe a similar volume of air, but through the mouth instead of the nose, then your body is going to have to recruit backup muscles in order to get the job done. This is because the diaphragm does not engage as well through mouth breathing as it does with breathing through the nose. And if we're always mouth breathing, then we're always using these backup muscles to do the breathing for us. And again, compensation is inevitable. Here's how you can quickly tell if you're a mouth breather or a nasal breather.
This does require some mindfulness, so pay close attention to what your body prefers. Place one hand on your stomach and the other on your chest and breathe in through your nose. Pay attention to what your body is doing. Are your shoulders rising towards your ears? Does your chest rise more than your stomach? And are you arching your back? When using the diaphragm, your chest and your stomach should be rising simultaneously, and there should be very little shoulder movement whatsoever.
So now you might be wondering, how can I both manage my stress, reduce imbalances, and practice my nasal breathing all at the same time? Reintroducing walking. Walking is a fantastic opportunity to work on all of these things. All we have to do now is work on ways in which we can implement more movement over the course of your 24 hours. Here are some awesome tips to help you get the most out of your walks. As always, speak to your physician or your movement professional before starting an exercise program. To start, try this nose unblocking exercise from author of The Oxygen Advantage, Patrick McEwen. This is a way in which you can improve nasal breathing, especially if you're unaccustomed to doing so. There are important considerations for this exercise, so you don't want to try this if you are pregnant or have high blood pressure or serious health issues.
Take a small, silent breath in through your nose and a small, silent breath out through your nose. Pinch your nose with your fingers to hold your breath. Then, walk as many paces as possible with your breath held. You're trying to build up a medium to strong air shortage, but without overdoing it. When you resume your breathing, only do so through your nose and try to make this as calm as possible.
When you conduct your walks, try doing so by only breathing through your nose rather than your mouth. If you do start to experience severe air hunger, it's completely okay to resort to mouth breathing and to reduce the intensity of your exercise. Also, while walking, you want to establish a good arm swing and stride to help promote movement of the rib cage and pelvis about one another, which can help restore flexibility and mobility in the back, hips, and torso.
If you're able to, invest in wearable technology and monitor your heart rate as you're nasal breathing and walking, and note your progress over time. If you're unable to walk longer durations, then simply aim to move more around the house by performing yard work or by being active with your kids. You could also sneak off your commute a few stops early and get your steps in that way. And of course, you can also walk with a friend, but make it a challenge.
Remember, exercise helps to manage stress and alleviate most musculoskeletal injuries. Nasal breathing is something that we can all strive to be better at. And the nose knows that the answer to most of our ailments is right here. Thanks for watching, and talk to you soon.